Welcome to this week's edition of A Journey for a Better Tomorrow. This is your host, Mitch Culberson.
And this is your co-host, Angela Culberson. Today's topic is one that is near and dear to my heart. This month is considered Sickle Cell Awareness Month. So our journey today is Breaking the Silence, Sickle Cell Speaks. Today we have two guest speakers. We have Mr. Preston Anderson, who is a registered nurse, case manager for the James R. Clark Sickle Cell Foundation. And we also have Dr. Jennifer Pender, board certified pediatric and adult psychiatrist, and also psychiatric consultant for Healthy Blue Choice Health Plan of South Carolina, and she's also a sickle cell warrior. If we can get one of you guys to introduce yourself, we're going to start with Mr. Preston Anderson.
Hello, my name is Preston. I've been working with people. My history goes back to hospital. I was an ICU nurse and got burned out and answered a blind ad and ended up at the Sickle Cell Foundation. And that was almost 30 years ago. And I fell in love with this population because in a lot of ways it is a very underserved population. And it allowed me to continue to use my nursing skills as well as give back to the community. And so initially we served about 15 counties. Now as a case manager, I serve the entire state of South Carolina.
Thank you. So next we have Dr. Jennifer Pender. If you would introduce yourself.
Sure, I'm Dr. Pender. I'm a pediatric and adolescent child psychiatrist. I went to Chapel Hill for school, undergrad, medical school, and my master's in public health, and then came to Columbia, South Carolina for my residency at the University of South Carolina with a partnership with Palmetto Health at the time. It's now Prisma Health, to become a psychiatrist. My sickle cell journey was unique in that my father is in the military, Marine, so he had pretty good health care with Champus at the time, and if you can believe it, had genetic testing with him and my mom, and he had sickle cell trait, my mom did not. So when I was born and started to have painful episodes of crying and they didn't really know what was going on, they would refer back to that genetic counseling and just thought it was growing pains. My mom was the kind of person who didn't let up, and she had a very intuitive sense about her. She also had other chronic illnesses and wasn't supposed to have children, so that's just a little bit about my mom. She has a lot what we call stick-to-itiveness. And I ended up actually at Chapel Hill when I was 3. And at the time, I think in the literature, I was born in the 70s, discussed illness that had the same, what we would say, phenotype, or it looks just like sickle cell, but the genotype is different. So I have sickle beta thalassemia 0. The 0 is important. That means I don't produce any normal hemoglobin. So my illness is very similar to, in course, to a person with sickle cell proper. Probably why I ended up at Chapel Hill, and I had planned to be a doctor because of the difficulty in getting and accessing healthcare growing up. And I just thought I could do it better and I had more compassion. So my goal was actually to be a pediatrician and treat children with sickle cell and assist them in their transition into adulthood, because I felt that was some of the transition times that I had the hardest with, going from pediatric care to not pediatric care. Pediatricians seemed to do an okay job, but adult medicine really did not know what to do with me as a person with sickle cell disease. But once I got to medical school, realized I didn't want to do the cancer part, and I just gravitated towards psychiatry. I'm really happy with my choice. I do get to help some kids with sickle cell. I do some speaking. I did some speaking at school in medical school as well. I don't come out with having sickle cell right up front, but if it helps someone, I will speak with them about it. One of the things I've noticed when I was working as an attending at the state children's hospital, one of the nurses there, her son had had a pretty significant crisis, and she was pretty down. And I told her that I had sickle cell disease, and she couldn't believe it, and how much I was working and how I went to school, and that she had only seen sickle cell patients in pain most of the time, and on disability. And so it gave her some hope for her kid, for her son at the time. And so I'm glad to be here on your podcast.
Thank you, thank you. So now I just want to give everybody a brief description of what sickle cell is, how it affects, how many people it affects in the United States. According to the National Institute of Health, sickle cell anemia is a group of inherited disorders that affects over 100,000 people in the United States and over 8 million worldwide. That's according to the NIH. In the United States, 9 out of 10 people with sickle cell disease or disorder are of African descent or identify as black. So that being said, I'm going to go to Mr. Anderson and ask you to give us a brief synopsis of what sickle cell is, who it affects, how it is, not only how it's treated, but how it is tested in order for them to know that you have sickle cell, and also any advancement that you see today that wasn't available prior.
Yeah, well,
I know that's a lot to ask.
that's okay. Well, just to talk about a brief history with sickle cell, you primarily see sickle cell in people of color because our origins are around bodies of water. And the sickle cell trait actually afforded you some type of resistance, or for lack of a better term, immunity to malaria. But as the gene mutated and became homozygous, it developed into the disease. And so you will see probably 95% of the people that have sickle cell disease be black. But there are people who are of other persuasions that have sickle cell. Primarily, you'll see a lot of people from the Mediterranean, like Greece, Turkey, and Italy, that will also have the disease. India, South Asia, of course, you will find those people too having sickle cell disease. Now, I think it's all states. It used to be 48 when I first started, but I think now all states test each infant at birth. Like people hear of the PKU and those type testing at birth, but they're also testing children for sickle cell disease. And so the foundation we'll set up so that we get those results. And that's how we usually bring people into case management in South Carolina. And of course, as we have progressed in the number of years that I've been with the foundation, we've seen some advancements in taking care of sickle cell. I mean, back in the day, it primarily was pain medicine, IV fluids. But you've had some newer drugs that's come on, like the Oxbryta, the Endari, hydroxyurea is probably the one that's been on the market the most. Recently, though, the Oxbryta, which a lot of patients that I was taking care of thought it was a game changer. But they recently, within the last year, recalled it because it was causing just some wacky side effects, and also in the long run, it was doing more harm than good. And so basically, in South Carolina, in Columbia, we have Prisma Sickle Cell Medical Home, and patients can go there. They can get IV fluids, they can get IV meds. They have doctors there that can write prescriptions and take care of the needs. And I just recently saw in the paper that they're opening another one down at MUSC. And so that is primarily what we're doing in South Carolina to take care of sickle cell disease. I personally don't think that enough research is being done. Um, I've heard of the new um, um, procedures that they're using now to possibly cure sickle cell disease, and um, I'm glad to hear that Medicaid will possibly be covering it, because it was just too expensive for the average person, especially in the situation that most sickle cell patients are in. Most of them are trying to live off of just disability.
Correct, correct. And that is great to hear. And I've heard also that they've been doing research with stem cell as well as bone marrow to help cure, or at least somewhat not get rid of, but at least to at least stop, not stop completely, but just slow down the progression
Yeah.
of
Yeah.
sickle cell. And I've heard of that for a while, then all of a sudden it seemed to just stop.
Well, what was happening with the bone marrow transplant was, one, it was hard to find a perfect match. Usually it had to be a sibling. Um, and so a lot of times we weren't able to find siblings that were a perfect match. And, um, and it is not that many hospitals or doctors are actually doing the sickle cell transplant. And it's tough on a patient that has sickle cell, because you essentially have to eradicate their immune system so that they don't reject it. And during that time, a body that's already vulnerable is just wide open to a host of infections and that type stuff. And that's one of the reasons it's not as prevalent as we did have about 10 years ago a young man who went to North Carolina, had the bone marrow transplant, and it was wow. He actually got cured and his blood type changed.
Wow.
It was really weird, and I've lost track of him, because of course now he's an adult,
He's an adult,
so he
right.
probably moved away somewhere. So
Correct. Well, thank you for that. That is very insightful. So, Dr. Pender, being a sickle patient or sickle cell warrior, have you come in contact with any disparities while seeking health care, seeking help from, say, for instance, the emergency rooms or hospital, any type of bias in treatment that you can think of?
Yes, where do I start? And I would, if you don't mind, about what I've seen over my years. I'll turn 50 next year, which I'm proud of, because it's higher than the average life expectancy for many adults with sickle cell disease. So as Mr. Preston said, the changes in testing, before we would only test children of African descent. So that has changed over time. So I think that it's great. I think there's been the use of hydroxyurea has been a super game changer, and that was directly from research done. Some of it was done at UNC Chapel Hill. I was one of the test patients of the pharmacokinetics of hydroxyurea. But that someone looked at it from, it's a chemotherapy drug, and noticed that people were having increased percentages of fetal hemoglobin. So that's the hemoglobin that babies have. And it doesn't have the same structure as adult hemoglobin, so it doesn't have the sickle gene. So that's how hydroxyurea works. And so I think that has been a big change. What I haven't seen is changes in the disparity of healthcare for African American people. I know we have been working on that, and there's been a project of trying to reduce health disparities, especially looking at social determinants of health. That was part of my master's in public health. My research I did back ages ago was looking at social determinants of health. So there has been some movement in it, but just personally, I've experienced much of the discrimination that just comes from being a person of color trying to access healthcare. And then on top of that, with sickle cell, there's a stigma of drug use or substance use dependence. Because of the high level of pain we're in, many physicians do not understand the level of pain management that needs to be done. And I've experienced that myself. And even just misdiagnosing or not providing standard of care like IV fluids, oxygen, as you stated, those are some of the go-tos, and we still have big misses even now. I recently heard about, I think it was a administrative educator who died in his 40s because he went to an emergency room here in the state and did not receive timely pain medicine and IV fluid, and he unfortunately passed away. And when I was in residency, there was a person who was admitted to our psychiatric unit in severe pain. They did not register that she had sickle cell disease, and she died from pretty much her heart failed from pain. So that's one of the things that I hope programs like yours raise a light on some of the maltreatment that still occurs. I think people would be a little appalled by that. But yes, I can just say yes. And even as a physician, it makes me not want to go to the emergency room or to the hospital for care.
And I can agree with that because I've seen that firsthand also, because I do have siblings, actually 3 siblings that has sickle cell, has the disease. And I have seen firsthand some of the disparities that they've actually had to endure by going to the emergency room. They've been labeled drug seekers. Oh, you're not in that type of pain. You should be okay. You don't need this. And then even at times, taking their time in getting units to the patient, which causes the crisis to be even more increased, when all they have to do is just look at the blood work. Being in healthcare, I know that all they have to do is just do a simple CBC just to see if this person is in crisis. If the bone marrow is throwing out immature retics or immature cells, which is considered retics, immature red blood cells, then that should give them some indication something is wrong. Also, when you see certain types of cells like your drepanocytes, your targets, your schistocytes in blood work, those are the things that they need to check. The hemoglobin, the red count, also check the chemistries, because when a patient is in crisis, their creatinine tends to go up. And that's one thing that I noticed a lot of doctors haven't been checking. They just say, oh, well, you just need some more fluid. They don't look at the fact that they're in a crisis. So I've seen that firsthand, how that can actually happen even in today's society. Actually, just less than a couple months ago, I've seen it. But I thank you for that. Also, how does having sickle cell affect you, not only physically, but mentally?
Oh, that's a good question. As a child, I suffered from depression, and my depression they have related to my anemia, secondary to my anemia. So the fatigue that comes with it, and just missing school. School was very important to me. So having to miss school due to a crisis or something like that caused me a lot of anxiety as well. Probably why I'm a psychiatrist. In terms of physical care, I've been very blessed. As I stated, in the introduction, I was diagnosed at University of Chapel Hill, and they provided most of my care growing up at the Comprehensive Sickle Cell Center there. I love those people, and I think I got probably the best care. And due to that, and knowing about my illness, what are the triggers, and how to prevent crisis. That's the primary thing for me, is trying to prevent a crisis. Understanding that it might occur, but I do the best I can to prevent it. Has helped me not have as many sequelae relate to my sickle cell. I do have had bilateral hip replacements, and that was related to bad care. So they did not understand how much pain I was in, and I got avascular necrosis of my hips. I've had my gallbladder removed, which many sickle cell patients have to have done due to we get a lot of crystallization from all the blood cells that are broken down. So usually gallbladders have to be removed. I still have my spleen, which is a good thing. So my keeping infection rates low. So COVID was pretty scary for me. I stayed in the house for about 120 days without going outside, which in itself was not great for my depression. So I do try to wear masks. Just simple hand washing, not going in many crowds. I limit my going to high elevations so I don't risk lowering my oxygen. And so there's just a lot that I do with my life. But because of it, as I said, I've been very blessed with the limited amount of sequelae. I did have some kidney, as you said, the creatinine level going up, and I have great internal medicine doctors, and so I'm monitoring that. The thing that's bothering me the most is diabetes, and we can have a whole nother show about that. And African American, so
Yes,
definitely.
that's kicking my butt more than sickle cell right now. So.
Well, that's great that you did mention high elevation, because I do know that sickle cell patients in high elevation tend to have more crisis.
Mm-hmm.
So.
And that's lower partial pressure of oxygen.
Correct.
Yep.
Okay.
So I live at sea level most of the time.
Smart. Okay, well I thank you. Thank you for those insights. So I'm gonna move to Mr. Anderson. I have a question for you.
Yes.
Being that you're with the James R. Clark Sickle Cell, how are they advocating for sickle cell patients, and for those sickle cell patients looking for support, not say monetarily, but just mental support in dealing with sickle cell? How can they contact you guys?
Of course, they can contact the foundation 803-796-9916. And if that number, unfortunately, we program all our numbers on our phones now. But if that number doesn't work, you can always call me. It's 803-467-9899. And all my clients, I call them clients because when I started with them, when I started with the foundation a while back, I made the conscious effort to call the people that we serve, the population that we serve that have sickle cell disease. I chose to call because a lot of times when we say that they're patients, there's a whole nother animal that's attached to that. And just to talk about some of the disparaging things that happen in healthcare, some of the things that, as a healthcare professional, I am actually embarrassed to know that they actually happen. I've actually had nurses in the ER who tell me, who have said to me, and I guess as a fellow nurse, they felt that it was okay to tell me that they will actually let sickle cell patients sit in the ER and eventually they will just go away. I've had patients call me crying, saying that they're going home because they've been sitting in the ER for 18 hours. And along with being there to get help and not getting help and feeling that you are ignored, that puts a whole nother level to your psyche, which probably facilitates the crisis even more. Several years, and I won't go into all the details, but I had a 22, 23-year-old went in, and he kept saying that something wasn't right. Something was wrong with his chest. And of course, the first thing they say, it may be acute chest, but he's young. He just wants drugs. Well, an hour and a half later, he was dead from a heart attack because he kept saying something was wrong, and the doctor wouldn't do anything. Just kept ignoring him. So I have tons and tons of these stories. So it is very real. And, earlier on in the conversation, you touched on it. It appears that as long as the client is with the pediatrician, they seem to get good care.
Right.
As soon as they switch from the pediatrician to the adult doctor, you become a drug addict.
Correct.
And I'm glad to see that one of the things that Dr. Roberts, who is a pediatrician here in town, one of the things that she's doing now is she's actually creating over at the Sickle Cell Home, helping in transition from pediatric care to adult care. And she's also actually keeping patients until 26, 27.
That's great.
So, and I think one of the other things that we do, other than just the monetary stuff like the Giving Tree, helping out with utility bills and things like that, is with the case managers, we try to look at each individual and see, and it's kind of like a puzzle, and you have to fit the pieces together to see how we can best help that patient and where we can sometimes get that patient to go for like social work, counseling, because as Dr. Pender says, there is a lot that goes on in your psyche with sickle cell, especially growing up. Body image, feeling that you're different. The number of kids that I end up going to the school when we try to do an educational plan that the teacher said, I didn't know that they had sickle cell, because a lot of them don't want teachers or their friends to know that they have sickle cell because they feel different. And so those are some of the things that we're trying to do in terms of helping people beyond just handing them a check. But of course, I don't have to tell you, Dr. Pender, or anybody that, of course, the money isn't long enough.
Correct. That is definitely the case.
As they say, there's too much month left after all my money's gone. There's too much care left after the doctor's gone
Correct.
or the money is gone.
So now let me ask both of you this question. Dr. Pender, you can start. With all of these disparities in healthcare and treatment, do you think there should be some re-education of doctors, nurses, and everyone in healthcare to get them all on one, get them on one accord when dealing with sickle cell?
I would hope education would help. The pessimist in me is worried that it's the isms of our society that trigger some of this, and I don't know how much education is going to help with that. So the optimist in me is, yes, we can re-educate. I know that when I was in medical school, some people thought that sickle cell, it was just something in books. It's hard to believe when you read it that people suffer from this illness, and especially in the South, we have the highest incidence of it. So, and having some compassion, you'd hope people in healthcare, they go into healthcare for that. But I understand we're burnout. COVID has made it almost impossible to be a great healthcare professional right now. We're all burnt out. There's too many people. One of my other psychology friends said that there's just too many humans who need help, and there's not enough humans to help. We're running out of humans. We're trying to use AI to chat with people, but we're just all burnt out. And so when you're burnt out and you feel that someone, you can't really help them, they can be easy to dismiss. So, yes, let's hope re-educating people and also reducing the stigma of mental illness, substance use disorders, which I know my national society, American Psychiatric Association, takes that very seriously, about reducing the stigma of those illnesses. So even if it's associated with someone having a higher incidence of substance use disorders, that they're not discriminated against when they require care.
Okay.
So let's hope.
We've actually done some education. I had one doctor who, his first year medical students, she would always have me come down and do a brief talk about sickle cell disease. And because apparently they don't get very much of it at all in school. And one of my first questions that I used to always ask is, what does a sickle cell patient look like? How can you tell a sickle cell patient when you see them? And of course, all those big brains and big minds would start churning because there had to be some kind of answer. And I said, you can't. They look like me and they look like you, And so in Western medicine, we always want to fix something. Let me go in and fix it. If I can't give you a pill and fix it, then. And so to see somebody who can appear in relatively good health, an arm's not broken, I don't have a knife in my chest or something like that. But when I describe the pain that I'm in, because usually they can be of another persuasion and they've never felt that kind of pain unless it was a heart attack or something was physically wrong, like a car accident or broken arm or something. They don't have anything to register that pain with. So their question is, how can you hurt that badly and nothing be wrong with you. You know what I'm saying?
Right.
And so as Dr. Pender says, going with all the isms, the easier answer is you have to be drug seeking. You have to just want drugs, you know. And so we've gone in and one of the nurses from the medical home, she and I used to do talks twice a month at the hospitals to the nursing staff that took care of the patients, the ER staff. And one of the things that we talked about was, you know, dependence versus addiction. And so people don't know that there is a very big distinction between dependence and addiction. Dependence actually has more of like what you would call a physical component. That's what gives you the tolerance you have for a drug, or if you don't get the drug, the withdrawal. Whereas an addiction has more of a psychological component to it. And you're going to display that behavior whether getting the reward, the drug is going to harm you or not. And so, in trying to explain the difference between dependence and addiction, um, you would see maybe in a crowd of 10, because we never got a big crowd, you'd see the light bulb go off in probably one person.
Yeah.
But I'm like Dr. Pender. I'm very skeptical that the education is going to change very much. I think what would have to change in terms of that happening would have to be a way that they look at the people who are wrapped up in this kind of skin.
Right.
They would have to look at them differently, and they don't look at us like that regardless of whether we have sickle cell or not. So
So they would have to change their whole mindset.
yes. And
Yeah, I think. Yeah, I'm sorry. Go with the president.
no,
Yeah.
I'm done. You can go ahead.
No, I'm just saying. You know what I said generally, that we already know there's tons of health disparities for African American people. You know, our mortality rate for birth,
Right.
for the mom and the baby, you know, it's across the board. So there's a systemic problem with that is then compounded with people with sickle cell because, as Mr. Preston states, we don't look like we're ill, and it's hard to imagine the pain. I try to explain it during the event in which I lost my hips. It feels like a train is running over my legs. So you tell me how that feels.
I can't.
And yeah, right, you can't. And so people can't imagine it. It's hard to imagine, but that's how it feels.
Gotcha. Yes, definitely. That is something we definitely cannot imagine unless we actually have to go through it. And I really thank you both for those answers. So in wrapping up, we know that, like I said today, this month is considered Sickle Cell Awareness Month, and we will continue on this journey throughout the month. I know, Mr. Preston, that James R. Clark have their sickle cell walk. You want to tell us a little bit about that and when it is and where it's located?
Actually, you caught me off guard. I
No,
know.
you better not. I know you know when this is. I can already tell you, September the 27th, if I'm not mistaken.
There you go. I'm gonna tell
It's
you.
usually too cold for sickle cell people to be outside walking, so I don't know.
Yeah.
It generally is.
Yeah. And you know what? Because right now it is so difficult to find nurses who want to do case management for sickle cell. And right now, there are about 4,000 people in South Carolina that have sickle cell. And James R. Clark probably has about 500 cases that are active cases, and right now it's just me and two other nurses for the entire state. So a lot of times I get the memo and and I show up. But in terms but yes, the sickle cell walk, anything that you can see that comes out with sickle cell, please come out and support it because, of course, a lot of our um, charity and funding went away with COVID, and it never really came back. Um, because along with COVID changing the whole landscape for healthcare, it changed the whole landscape for jobs. And I don't know if you would say, fortunately or unfortunately, um, a lot of companies found out they could do more with less.
Yes.
So a lot of people who donated didn't have the jobs to go back to or whatever. But yeah, September 27th, and I think it's early in the morning, about 8 o'clock.
I think that's normally.
It's usually about 8 o'clock.
8 o'clock.
And you can get back with me. You have my number. Give me a call. And it's usually over at the Martin Luther King Park. Is where it starts. And I've often thought that it was a little cold for people with sickle cell to be walking at the time.
I was wondering
But-
why they chose September as Sickle Cell Awareness
Well, I
Month.
think they chose September because that's actually Sickle Cell Awareness Month.
Okay.
So,
No, I'm saying I'm wondering why they chose that month as Sickle Cell Awareness as
oh,
opposed to a
yeah.
warmer month where.
Yeah, yeah.
But it's
June,
yes, yes. Well, I definitely thank you. Well, Dr. Pender, is there any other thing or pointers you would like to give anyone or encouragement you would like to pass on to anyone else that's dealing with sickle cell?
Well, I hope I give some people hope that you can do what you want to. You do have to make some sacrifices, and it's a lot of prevention, and I miss a lot of things, and I don't go outside most parts of some of the year because it's too cold. But I'm very blessed and very grateful for the health care I did receive. And the true warriors, our family that support us, that show up for me when I was in the hospital. My family always had a round-the-clock care. Somebody was always there, usually my mom, and she wouldn't leave. So we need our family to help us and advocate, because when you're in that much pain, it's hard to advocate for yourself. So, we need you. And that's all I got.
Mr. Anderson, do you have anything else you would like to pass on?
The only thing that I could say is on this journey that I've had in working with people that have sickle cell disease, I would have never been able to conceive of the suffering, the heartaches, the broken ambitions and stuff that one population could have it all. And one of the reasons I work and I strive to be so diligent in case managing these clients is because a lot of people have just forgotten them in a sense and left them behind. The healthcare community has. I'm glad, because when you think about most of the advances that we've made in the care of sickle cell in terms of new procedures, new drugs, they've happened within the last 10 years. And when you look at all these other diseases and whatever, they've been working on them constantly. The only other disease that I think is treated as harshly, and I'm sure Dr. Pender can attest to that, is mental health. Um, you know, when you look at some of the drugs that they're still giving people that have mental health, they're 50 years old. You know, and so I would just say that as much as you can enjoy, I've enjoyed working with people because once you get to know these, these clients, you realize they're people just like you and I, and most of them just want a chance
Correct. That is correct.
and someone to see them, hear them, and help them understand their disease.
Okay. Well, I thank you both for joining us today. Thank you guys so much for coming out and taking this journey with me. This is, like I said, one that is near and dear to my heart because of the people I have to sit there and look at every day and say, hey, something is wrong with them. Hey, have you checked your blood levels? What's going on? You don't look good. But in having siblings that has sickle cell, this is something that needs to be talked about and needs to be talked about daily, not just a once a year thing. So we just want to continue on with that, encouraging everybody in the sickle cell community. If you need help, reach out. Don't just sit in your pain. Go get help. Despite what doctors or nurses and how ER may, treat you, there's other ways that you can get treatment and get it treated correctly. They have case managers or patient advocates in hospitals if you're having problems. If the nurses aren't doing their job, if you're having problems with the doctor who's not wanting to treat you fairly, contact a patient advocate. That is their job. That is what they're supposed to do. If there's a problem, they should be able to come there and help you. But for this journey, we just want to get the information out. We just want to advocate for sickle cell. And again, I thank you both for coming. And that completes this topic for today. So I'm going to pass this back over to the host.
Excellent show, guys. Excellent show. Certainly, we want you guys to stick around. We have another little segment called Ask Mitch and Angie. And with that Ask Mitch and Angie, it's just a tie-in to what you guys have been talking about today. Y'all pretty much already covered a lot of the things, but this will tie it right on back in. Again, with A Journey for a Better Tomorrow, this is more than a podcast. This is a movement, and you guys are taking part in this movement. And so on the Ask Mitch and Angie questioner today, as professionals deeply rooted in emotional wellness and healthcare, how do you think we can better support individuals and families navigating the challenges of sickle cell disease, not just medically, but emotionally and socially? And we'll chime around and we'll each know what our little input is on that. It don't have to be nothing too in depth, but we'll start with you, Angela.
Just show up. Show
Good.
up for them.
That's good.
Show up for them mentally, physically, and emotionally.
Yeah.
Let them know if there's a problem, I'm here. Don't just say I'm here and then not be able to be contacted. But be there physically, mentally, and socially and emotionally. And that's pretty much what I got.
That's good. That's good stuff. How about you, Doc?
Oh, that's a hard question, really.
Thank you.
Sometimes, at least for me, I am pretty stubborn, and I don't like asking for help. So even when I'm having pain, and so I think your wife's answer is probably the best, is to be there and to be around, and to check in on people who do suffer from chronic illness, not just sickle cell, but other chronic illnesses, because from day to day things can change, and it's really helpful just having someone who checks on me and reminds me to drink water, and did I do this today?
Yes,
because
definitely.
some days it's a lot. And I think having those people in my corner really have saved my life. and great mentors. So if someone's willing to mentor a young person with sickle cell, I think that will change their life as well. I had excellent mentors growing up. Doctors, obviously, a great doctor mentor in medical school, and they helped me navigate when I did find that I had difficulty with accessing care, or if I had questions about my career, or am I just, is it, what's going on? And they were there. So that's what's helped me, at least for my journey.
Wow. Preston?
I think what I've found in the years that I've been working with people that have sickle cell is that hearing them. You would be surprised at the number, how much time I will spend in a house not saying a thing. But when they have this disease that has gotten them even more stigmatized than the skin that they're wrapped up in, when they're basically, in a way, shunned by the medical community, and sometimes even shunned by their own families. Um, just being an ear, not giving an opinion, not giving, just shut up and listen. And sometimes I had one client last week say, "Oh, Mr. Anderson, I've been talking for 30 minutes." But you can tell at the end of that 30 minutes, she felt better. And so I would say, listen, and listening has to do more than just the sound going in the ear. Is actually hearing what they're saying, and I think that's huge.
Yes.
Definitely.
And mine would be just doing what we're doing today, having more conversations like we're having today, and having more things like this, and getting that out there. And so, a journey for a better tomorrow is more than a movement. Yeah,
Podcast, it's a
Sure.
movement.
yeah, yeah.
I know.
It is, no
You
doubt.
got it messed up.
I did get it
You
messed up.
really got it
Angela.
messed up.
We gotta get our mantra back there. Journey for a better tomorrow is more than a podcast. It's a movement.
All righty.
Thank y'all again. All right, excellent session today. Excellent session. We're gonna go ahead and finish it up, wrap it up with our mental health tip. The mental health tip this day is tied into the tough topic we went through, but find a practitioner that could assist you with emotional and physical pain. The preferred approach is cognitive behavior therapy, or cognitive-based therapy there. Cognitive behavioral therapy for chronic pain, CBT, CP. It's a powerful evidence approach that helps people reshape how they think, feel, and behave in relation to pain. It's not about denying pain, it's about reclaiming agency over how it affects your life. So make sure that you get the treatment that's going to be able to assist you from a mental standpoint and a physical standpoint, to be able to help you through this. And so journey forward with us as we continue to move on this mission to educate and inform. Thank you for this addition to a journey for a better tomorrow, where it's not just a podcast, it's a movement.